Hey, what's going on, everyone? Today is Wednesday, and this is the day that I answer your emails about your questions about your health. Today I got an email from John, and John is asking this. Hey, Dr. Bo, I have a 14-year-old son who is now starting to play football. In his training, he is starting to complain of his knees starting to hurt, and that's both sides of his knees right below the kneecap. I was wondering if you could give me any advice or potentially even know what's going on with him. Much help, much love. Love the show. Thanks a lot, John. Hey, John. All right. Well, first off, it's so awesome that your son is starting and playing football. I think that's, incredible. As you know, I've got a long history with football, so I'm a super advocate with that. As a person who does a lot of sports injury care, this is something that we very commonly see with our younger athletes that are just starting to go through puberty. What your son is talking about is something called Osgood-Schlatters Disease. Now, don't let the name scare you at all. It was just invented or found by a guy named Dr. Osgood-Schlatter, and he started to see a preponderance of this in his practice. Now, what it is this. Over the knee, you have basically two big bones, right? You have your femur that's coming down, that's your main leg bone, and your tibia, and they kind of sit over the top of one another. And then on the front, you have your patella. Now, here's an interesting fact. Babies do not have patellas. Matter of fact, the patella is not developed to about year 2. So next time you pick up that cute little baby and feel them around a little bit, they don't have patellas. So where does it come from? Well, what the patella is actually a growth of the quadricep that goes over the knee joint, and it inserts on the bottom portion of the tibia called your tibial tuberosity. Now, as the knee and as the leg bends and goes open over the femur, it starts to create friction, and that friction starts to lay down bone, and boom, we all have patellas. Now, why is your 14-year-old son having issues with that? Well, when we're in puberty, our bodies are growing crazy, right? This is like where people come into my practice and say, hey, my son grew 2 inches in the past year. He's eating me out of house and home. Literally, all he does is eat, sleep, eat, and sleep. And that's completely right. So your son right now is growing really, really fast. And what's happening is his bones are starting to become longer and stronger, and his muscles just can't keep up fast enough. So what we see is where that patella comes down and inserts over the tibial tuberosity, that it's actually starting to avulse off. Let me show you a picture so you have a little bit better understanding of what's going on from a visual perspective. All right, so I'm going to hold this up to the camera here, and as you can see what we've been talking about, this is just a picture. This is his kneecap, this is the top of the femur, this is the bottom portion of the tibia. The gray portions that are in there, you'll notice that is just the growth plate areas. Now what we see is that the patellar tendon coming down, it goes and inserts on this portion called your tibial tuberosity. Now, as your son is getting stronger and taller, what happens is that the patellar tendon, because it's very strong, the extension of the quadriceps, is actually starting to pull off of the tibia, and that right there causes a lot of pain. Matter of fact, it can get so bad that it can actually avulse or pull the bone off. And some people even have this. If you feel down the front of your knee, right over that area, you feel kind of like a bigger bump. And that's something that probably happened when you were a little person, or a little guy, or a little girl. And that started to, it starts to get stronger. The patella starts to lay down more tissue. The quadriceps loosen up, and the bone starts to deform and to grow. Now, what can we do about it, right? Because I'm sure your son wants to continue to practice and continue to play. The first and most easiest thing is to ice the area. Now, I like to use ice cup massage. So that's like the little Dixie cups. Take some of them, fill them with water, freeze them, pull them out when they're frozen, tear the top off, and go directly right over the top of that patella. Massage it in there for about 5 minutes. That's really direct ice, which will help really lower it. The second and probably most important thing is that the patella tendon is nothing more than a extension of the quadriceps. So I really highly bet that your son's quadriceps are extremely tight. So back to kind of our picture here, the quadriceps obviously are kind of up here, right? So what you want to do is you want to get in there and massage and really work over those quadriceps, get them nice and loose, have them do a lot of stretching. You know, take a foam roller, start rolling over the top of the quadriceps, take a lacrosse ball or a trigger point ball and work over those muscles, especially over that inside portion of that leg, that vastus medialis oblique, that's the name of that muscle, and on the outside portion, the vastus lateralis, and even over the iliotibial band, which lines the outside portion of the leg. What that does is it helps to loosen up the muscles, right? Yes, you could probably treat it with an anti-inflammatory. Yes, turmeric would be awesome to take. Yes, garlic would be amazing to eat as well. And the last thing you can do is you can buy a little brace that goes around the knee, and it's called a Chopat brace. And what that does is it helps to just change the angle of where if this is the patella, is pulling off. The brace kind of sits over the top, so it allows it to kind of stay in place and changes basically the angle point of where the patella is working from. I hope that really helps to answer your questions, John. That's awesome that your son is going through this and he's playing sports and he's getting indoctrinated. I will tell you this though, this is one of those things that can potentially take weeks to sometimes months to work through, to heal, and to loosen up, and it's something that he's got to work on literally every single day. Many of my patients come in, bad pain like this. They really do this for a couple of weeks. They come in, we recheck them. I said, how are the knees doing? And they say, you know, Bob, I don't even remember what's going on with the knees. What were we talking about? Or, you know, hey, it's 80% less, or, you know, it's 70% less. So I say, great, you know, you want to ice before practice, you want to make sure we're icing after practice using the ice cup. We want to stretch, we want to roll, we want to try to keep all of those muscles nice and loose. All right, guys, I really appreciate all of the letters that you guys send me. It's really amazing stuff. Please keep them coming. Please keep asking me questions. I love to do this stuff. Your feedback is incredible to me. I really look forward to seeing you guys here next week. Again, ask any questions about this. Osgood-Schlatters disease, prepatellar tendonitis, whatever you want to call it. Let's just fix it and let's get our kids out there playing more sports. Have an amazing Wednesday. Talk to you soon. Bye.